number one surface that is outlined over here, as we can appreciate. So over here, this is the subchondral bone. This is the bone which is the subchondral bone. Okay. Now what has happened over here, we can appreciate some amount of cartilaginous material, some amount of cartilage, articular cartilage is yet maintained. But if you appreciate in the other areas that there is loss of articular cartilage and complete exposure of the bone, as we can appreciate in this diagram. So the subchondral bone, so the number one thing that we are shown in the with the help of arrows, it is the subchondral bone that is being exposed. Why? Because of the destruction and degeneration of the articular cartilage. Okay. So over here, the number 3, this is the residual cartilage that is remaining over here. Now, as I told you that this bone, because of repeated damage, they will start to develop some cracks. Okay. And ultimately, they will develop some loculated surface. Can you see? Some loculated surface are over here as well. Small loculated surface which is forming subchondral cyst. So the number 2 structure, as we are looking over here, it is the subchondral, it is called as the subchondral cyst, as we can appreciate. Welcome back. Myself, Dr. JIBRAN Ahmed, presents to you Simply Pathology, and today we are back with a very important video. In the previous lecture, we have read about rheumatoid arthritis. In today's lecture, we are going to understand about the second important clinical arthritis, that is osteoarthritis. So let us begin without wasting any more time. So as we have already seen before, that rheumatoid arthritis that we have read in the previous lecture, it was mainly an autoimmune disorder. But osteoarthritis, if we see, osteoarthritis that we are watching, it is the most common type of joint disease, and it is also called as a degenerative joint disease characterized by cartilage degeneration. Okay, so there is very little or there is no inflammation of the joints. So there is no inflammation. Inflammation was forming a very important component of rheumatoid arthritis, whereas in case of osteoarthritis, the inflammation is not playing a very important role. Remember that there are 2 important types of osteoarthritis. One is your idiopathic or primary variety of osteoarthritis. Another one is your secondary variety of osteoarthritis. Majority of the cases of osteoarthritis, they are idiopathic or primary in nature. That means there is no well-defined cause. It occurs usually gradually, and it is regarded as an aging process. Now, what happens over here, that this idiopathic or the primary variety, okay, is affecting very few joints. Okay, it is oligoarticular, it is involving older individuals, and very important thing is, although it is involving only few joints, it might be generalized in few cases, but mostly they are involving few joints. Now, around 5% cases of osteoarthritis is involving younger individuals with certain predisposing conditions. So what are those? For example, a young individual is having any kind of joint deformity, or there is any history of previous joint injury, or there is any secondary disorders like diabetes mellitus, ochronosis, hemochromatosis, or marked obesities. So when some secondary cause is present, then we are calling it as a secondary variety of osteoarthritis, and very importantly, this is forming a minority group of osteoarthritis. But majority group, they are idiopathic or primary, and they are occurring gradually in basically older individuals. So it is an aging phenomenon, and usually they are localized, they are oligoarticular, but they sometimes might be generalized as well. So coming to the gender, if we are looking at the gender, then in the males, the hips are the most commonly affected, very important MCQ, whereas in case of females, it is the knees and the hands which are most commonly involved. Now, age is a very strong risk factor for osteoarthritis. There's an increased prevalence of osteoarthritis in individuals more than 50 years of age. So having discussed the introduction of osteoarthritis and having known that this is basically a degenerative disorder of the cartilage, and especially inflammation is not having a very big role over here. So with this concept in mind, we are going to begin with the pathogenesis of osteoarthritis. So the basic abnormality in osteoarthritis is not inflammation, unlike in rheumatoid arthritis. But over here, there is a degeneration of the articular cartilage. Okay, and there is a disordered repair of the cartilage. So some problem is there with the cartilage over here. So what is the problem? Let us try and understand. There is some kind of biochemical stress. Okay, along with that, certain predisposing genetic factors are there that causes injury to the chondrocyte, plus they are also going to alter the extracellular matrix material. And that is going to cause increased chondrocyte proliferation associated with increased amount of proteoglycan synthesis. But we have to understand over here that as the disease is progressing, the amount of proteoglycan synthesis, okay, is becoming less as compared to the amount of proteoglycan degradation. So the amount of proteoglycan degradation is far more than the proteoglycan synthesis. Okay, plus there is also certain changes in the composition of proteoglycan, the amount of water increases. Okay, so very importantly, because of some kind of biochemical injury or in predisposed individual with certain genetic factors, that is going to lead, number one, to chondrocyte injury, leading to alteration of the matrix, increased proliferation of the chondrocyte, leading to proteoglycan synthesis. But as the disease progresses, the synthesis will become less as compared to the degradation. Okay. Not only that, the chondrocytes, they also increase the synthesis of matrix metalloprotease. Now, these are certain groups of enzymes that is going to degrade type 2 collagen. And again, the extracellular matrix will become degraded. And as a result, this is going to lead to fissuring of the articular cartilage. Now, along with this, the chondrocytes and the synovial cells, they increase, they synthesize an increased number of cytokines, like we are having TGF-beta, TNF, prostaglandins, along with that nitric oxide. Okay, now this TGF-beta is important for increasing the synthesis of matrix metalloproteases, which again, as we have seen, they are responsible for degradation of type 2 collagen. And whatever remaining cytokines are there, they are maintaining a chronic low level of inflammation, and they are also contributing in some way towards the disease progression. In the later stages, what is going to happen? The chondrocyte will become lost. So there will be loss of the chondrocyte, loss of the articular cartilage, and severe matrix degradation, because the quality of the extracellular matrix is gone. Along with that, the proteoglycan degradation becomes very high. So ultimately, there's a loss of the matrix. So whatever we have discussed, I am going to explain you now with the help of diagram. So this is basically a joint, as we can appreciate, and we have taken this joint over here and we have magnified. Now, this is basically a normal joint wherein you can see this is the bone below and over here the cartilage above. So normally we can appreciate there's a full thickness of the articular cartilage over here. But for example, because of some kind of biochemical injury occurring in individuals who are genetically predisposed, they are going to cause some kind of damage to the articular cartilage, and as a result, some amount of chondrocyte injury will be there. Okay, and because of that, there are certain changes that is going to happen in this particular situation. So the process is basically initiated by biomechanical cartilage injury in individuals who are genetically predisposed. Okay, and in such individuals, there are certain chondrocyte proliferation. Along with that, there will be changes in the composition of the extracellular matrix. Secondly, what happens that after that, in case of early osteoarthritis, we are going to see that there will initially be the chondrocyte proliferation, and along with that, they will have increased synthesis of proteoglycans. But as the disease is going to progress, what we are going to see that the proteoglycan degradation becomes more than the synthesis. Now, this chondrocyte proliferation is also followed by some attempted, there's an attempt to repair as well. So what happens, the chondrocyte that is proliferating, they start to release certain matrix metalloproteases which are degrading further the matrix by degrading the collagen. They are releasing agrikinases which is going to degrade the proteoglycans. Not only that, the chondrocytes along with the synovial cells will release a plethora of cytokines like TGF-beta, which again is stimulating the chondrocyte to increase the synthesis of MMPs, and further degradation of collagen is there. Along with that, the synovial cells and the chondrocytes are also releasing certain cytokines like PGE2, nitric oxide and TNF, which are responsible for maintaining chronic low-grade inflammation, which can lead to progression of the osteoarthritis. Now, in the later stages of osteoarthritis, what is happening, as we can appreciate, okay, just we are going to compare from this part. In this stage, already what we can appreciate that because of this early osteoarthritis, there are fissuring that has already started. That means the loss of articular cartilage is already there. And in the late stages, if you see, the amount of cartilage that remains is very less. Okay, and what is happening over here? There is basically death of all the chondrocytes in the form of apoptosis, and there is loss of chondrocytes. Not only that, apart from that, the chondrocytes, they are breaking and they are coming out. Okay, some parts of the articular cartilage is coming out in the form of loose bodies, and very importantly, you can see the extracellular matrix over here is also gone. So as a result, what is happening over here, that the bony surface is now coming directly in contact with the other bony surface. So as a result, this bone is becoming the articular surface. So there is a complete loss of the articular cartilage and exposing the subchondral bone as well. So late osteoarthritis, as we can see, there is a loss of both the matrix, as we can appreciate over here. Plus, along with that, there is a loss of chondrocytes, and the subchondral bone is basically exposed and now becomes the friction surface with the above articular cartilage, leading to changes in the bone as well. Now, having discussed all these points, now we are going to discuss in details the morphology of osteoarthritis. Now, it is characterized, as I told you already, there is a chondrocyte proliferation along with cluster formation in early osteoarthritis. Now, the matrix, the amount of water in the matrix increases, whereas the proteoglycan concentration decreases. And because of excessive release of matrix metalloprotein, there is also breakdown of type 3 collagen. These are all leading to loss of the extracellular matrix material, leading to the formation of fissures and clefts. So over here, as we can appreciate, okay, as we can appreciate over here, the fissuring process can be appreciated. If everyone can see, this is the fissuring process. Again, over here also, I can demonstrate the fissuring process that I was already discussed. So this is the fissuring process that we can appreciate over here in this diagram that has already started. So there is a loss of the extracellular matrix component. Okay. That leads to a very granular and very soft articular surface. So what happens, the articular surface is losing the extracellular matrix and they are becoming very soft. It is altered. So as the chondrocytes, they are dying, then full thickness of the cartilage is sloughed off. They are lost. And what is happening, that this cartilage that is sloughed off, they are entering the joint space, and this is forming what is called as loose bodies. So loose bodies are nothing but those chondrocytes which have died, and because of which the articular cartilage, a portion of the articular cartilage that has come off and entered the joint space, forming what is called as loose bodies. Then because of this process, as I told you, the entire articular cartilage is getting destroyed and it is coming off. So the underlying bone, that is the subchondral bone, is getting exposed. And now that is becoming the new articular surface that is going to, it is going to form friction with the articular surface, and they will become burnished by friction from the opposing surface, leading to what is called as bone hibernation. Now the underlying articular surface will undergo what is called as rebuttressing, and because of constant damage, there will be sclerosis that will be appearing as whitishness in the X-rays. Apart from that, because of constant damage to the subchondral bone, they will develop some small cracks that is going to allow the synovial fluid to enter into gaps, and loculated fluid collections will occur, which is forming what is called as a fibrous walled cyst. So what is that? We are going to try and understand what is that. Okay. So this is a diagram. Okay. This is the diagram of osteoarthritis that we can appreciate. This is the gross diagram that we can appreciate in this particular diagram. So let us try and understand over here the different kinds of surface. So the number one surface that is outlined over here, as we can appreciate. So over here, this is the subchondral bone. This is the bone which is the subchondral bone. Okay. Now what has happened over here, we can appreciate some amount of cartilaginous material, some amount of cartilage, articular cartilage is yet maintained. But if you appreciate in the other areas, that there is loss of articular cartilage and complete exposure of the bone, as we can appreciate in this diagram. So the subchondral bone, so the number one thing that we are shown in the with the help of arrows, it is the subchondral bone that is being exposed. Why? Because of the destruction and degeneration of the articular cartilage. Okay. So over here, the number 3, this is the residual cartilage that is remaining over here. Now, as I told you that this bone, because of repeated damage, they will start to develop some cracks. Okay, and ultimately they will develop some loculated surface. Can you see some loculated surface are over here as well? Small loculated surface which is forming subchondral cyst. So the number 2 structure, as we are looking over here, it is the subchondral. It is called as the subchondral cyst, as we can appreciate. So this is how grossly it appears morphologically. Okay. Now, not only this, what is happening, the mushroom-shaped bony outgrowths, osteophytes, is also developing at the margin of the joints. So at the margin of the articular surface, you are going to see the development of bony outgrowths that is called as osteophytes, which is capped by fibro and hyaline cartilage, which is going to gradually ossify. Okay, the synovium is going to show mild congestion and few amount of inflammatory cells. So let me again show you with the help of a diagram what are osteophytes, so that concept becomes clear. I will come over here. Okay, so this is a basic diagram wherein we are comparing and contrasting rheumatoid arthritis versus the osteoarthritis. Okay, so very important. I am just going to revise. Now, as we know, in case of rheumatoid arthritis, inflammation is playing a major role, whereas in osteoarthritis, it is the biochemical damage plus genetic susceptibility which is playing the major role. Inflammation also has a role, but that is not that much prominent as compared to rheumatoid arthritis. So in rheumatoid arthritis, we are having inflammation. So as a result of inflammation, there is a mass of edematous tissue along with the inflammatory cells called as the pannus. Some amount of cartilage starts to erode over here also. But over a period of time, joint deformities also occurs in rheumatoid arthritis with the presence of fibrous ankylosis, where there is a fibrous union of the there's a fibrous union of the bones, as we can appreciate over here, and this is called as fibrous ankylosis. And similarly, over a period of time, the joints on the opposing end, the bones on the opposing end they might also join. This is called as bony ankylosis, and these are classical features seen in rheumatoid arthritis. Whereas in case of osteoarthritis, as we have seen that there is basically loss and degeneration of the articular cartilage. We can appreciate over here the articular cartilage has become fibrillated. Okay, they have become fibrillated like this because of loss of the cartilage. Okay, now at some areas the complete cartilage is lost, so beneath there is a subchondral cyst formation, as we have seen over here. And beneath that, because there is constant damage, subchondral sclerosis also occurs. That means whitening and fibrosis occurs because of long-standing injury. Now at some places what happens, as you can appreciate in this particular part, that this area is completely devoid of cartilage, and as a result, peripherally, this amount of bone, okay, they have formed an osteophyte. A bony outgrowth is formed over here, which is forming what is called as a osteocyte, as we can see. Now, unlike rheumatoid arthritis, no ankylosis can be seen in case of osteoarthritis. So coming to the histological features, okay, coming to the histological features of osteoarthritis. So we are just going to see all the points. So as we can appreciate, so this is basically the cartilage. This is the articular cartilage, and if you can appreciate, some areas there is a loss of the cartilage. Yes, so there is what is called as fissuring. There is a fissuring or fibrillation of the articular cartilage. As the cartilage is getting lost, they are forming very small bodies, as we can appreciate over here, and these are entering the joint space. They are called as the loose bodies. As we can appreciate, they are called as the loose bodies. And this area, you can see, it's a cartilage. Slowly and steadily, this cleft is going to go down and expose the subchondral bone, leading to the characteristic changes in the bone as well. So this is all about the morphology of osteoarthritis that we have discussed, both the gross as well as the histologic features, and we have compared and contrast between the rheumatoid arthritis versus osteoarthritis as well. Now coming towards the last leg, that is the clinical features of osteoarthritis. So individuals with primary osteoarthritis, they are asymptomatic until they are 50 years of age. Now if a young person is having significant manifestations of osteoarthritis, then it might be a secondary osteoarthritis, and we should search for secondary causes like any kind of joint injury in the past or any kind of secondary disorders like diabetes. Now, characteristic of the symptoms include deep achy pain that is worsened with use. There is a morning stiffness. So the pain is getting bad, okay, with using. So with time it is getting bad. Deep achy pain that is worsening with use. There is a morning stiffness with presence of crepitus, and there is a limitation in the range of movement. Okay. Now impingement of the spinal foramina by the osteophytes result in cervical and lumbar nerve root compression, and this is going to lead to radicular pain, muscle spasms, muscle atrophy, and neurological deficits. Now, typically only one or few joints are involved, so it is not that much, it is not a systemic disorder. Okay, so very rarely it is generalized. The joints which are commonly involved are the larger joints. So in rheumatoid arthritis, the smaller joints were the ones which were mainly involved. But over here, the hips, knees, lumbar vertebra, cervical vertebra are the one to become involved. And later on, the proximal and distal interphalangeal joints of the fingers, the first metacarpal joints and the first tarsometatarsal joints are involved. Now, very importantly, one characteristic feature of osteoarthritis is the presence of Hubbardin nodes. Now, classically, this was an MCQ that was asked to you in my community channel, in my community page, and most of you have chosen the answer as rheumatoid arthritis. So, right now you got the answer that Hubbardin nodes is the classical feature of osteoarthritis, and these are nothing but these are prominent osteophytes at the distal interphalangeal joints, and they are more common in women. Okay, the wrist, elbows and shoulders are usually spared. Okay, so let me just show you this diagram. So the distal interphalangeal joints, okay, you can appreciate the distal interphalangeal joints over here. Okay, the distal interphalangeal joints, they are having some swelling that is called as the Hubbardin nodes. Okay, Hubbardin's nodes. So distal interphalangeal joints, they are showing the swelling that is forming what is called as the Hubbardin's nodes. Okay, distal interphalangeal joints forming the Hubbardin's nodes. Now, joint deformities can also develop in case of osteoarthritis, but unlike rheumatoid arthritis, the bony ankylosis and fibrous ankylosis doesn't occur. That means there is no fusion, no fibrous, no bony fusion between the joints. That is not there. Okay, and the level of disease severity detected radiographically does not correlate well with the pain and disability. Now, remember that there are no treatments to prevent or halt the progression of primary osteoarthritis, because over here it is not an inflammatory disease per se. Unlike in case of rheumatoid arthritis, steroids were having important role, anti-TNF therapy was there, but over here no such primary treatment is there. Just there are therapies to reduce the pain. So NSAIDs can reduce inflammation, intra-articular corticosteroids can be given to reduce inflammation, activity modification can be done, and for severe cases arthroplasty might be done as well. Coming to this last diagram, the X-ray changes of severe osteoarthritis. So what I want to tell you, can you appreciate, this is basically the head of the femur. This is the head of femur, as you can appreciate. Now what has happened over here, can you see the joint space? The joint space is completely decreased inside. You cannot see joint space. Subchondral, that this is the subchondral space, as you can appreciate, it is completely white. So this is called as subchondral sclerosis. So what we can appreciate over here is subchondral sclerosis can be seen. Okay, very importantly, I don't know if you all can appreciate over here, very small round, okay, clear spaces can be seen, appreciated. What are these clear spaces? These are nothing but the radiolucent subchondral cysts. So these are the subchondral cysts, as we can appreciate. Now over here also, if you can see, because of loss of the cartilage and because of overgrowth of the bone, there is some osteophytic growth or bony lipping is there. This is characteristically called as the osteophytic lipping. There is an excessive bony outgrowth that we see. This is a characteristic feature. Joint space is narrowed, there is subchondral sclerosis and scattered oval radiolucent cyst and peripheral osteophyte lipping. So with this, we have completed osteoarthritis, which is another very important clinical entity, and I hope you have understood this lecture very well. Thank you, and do write down your doubts in the comment section. Thank you very much for watching this particular video.